Grog, let's talk a bit about oral routes of nutrition support. In a few sentences, keep it nice and short.
Oral nutrition support boosts calorie and protein intake with fortified foods, like high-energy meals or snacks, and supplements like protein shakes or nutrient-dense drinks. It's the go-to for 60% of at-risk hospital patients who can eat, preventing malnutrition worsening, per Clinical Nutrition 2021. Dietitians tailor plans to appetite and needs, often adding oral nutritional supplements for quick impact.
Okay. And when oral nutrition is unsuccessful, we go to enteral, parenteral. Explain us parenteral.
Parenteral nutrition delivers nutrients directly into the bloodstream via an IV, bypassing the gut. It's used when oral or enteral feeding fails, like in severe bowel obstruction or short bowel syndrome, providing tailored mixes of carbs, proteins, fats, and micronutrients, per Frontiers Nutrition 2024. It supports 5 to 10% of hospitalized patients, but carries risks like infections or liver issues, so it's closely monitored. Want me to compare it to enteral or dive into specifics?
Well, so enteral, if gut is functioning, we use enteral basically. So maybe we're unable to swallow in enteral, maybe we're unconscious, we don't have oral intake, we don't have sufficient oral intake. Yeah. So,
Yeah, exactly.
yeah, and tell us about parenteral. So, in which situations it would happen? Maybe a peristaltic, obstructed.
Parenteral nutrition is used when the gut can't function or enteral feeding isn't possible. This happens in cases like complete bowel obstruction, severe ileus, aperistaltic gut, or short bowel syndrome, where nutrient absorption is shot, per Frontiers in Nutrition 2024. It's also common in severe pancreatitis or major GI surgeries when the gut needs rest, affecting 5 to 10% of hospitalized patients. IV delivered nutrients keep these folks stable, but it's high risk for infections, so it's a last resort. Want me to detail one condition or the setup process?
And what about explain me? I don't know what a peristaltic mean. And yeah.
Aperistaltic means the gut stops moving. No peristalsis, the wave-like muscle contractions that push food through. It happens in conditions like severe ileus, often from surgery, infection, or meds, causing a paralyzed bowel, per Stat Pearls 2024. This blocks nutrient absorption, so parenteral nutrition, IV feeding, is used to bypass the gut, as enteral feeding won't work. Want me to clarify a condition causing this, or stick with nutrition options?
Okay, let me ask you about the gastric aspiration port and the jejunal administration port. And what are these?
Gastric aspiration, also called gastric residual volume checking, involves suctioning stomach contents via a nasogastric tube to assess how well the stomach is emptying during enteral feeding, per Clinical Nutrition 2021. It's done to prevent overfeeding or aspiration pneumonia, though its routine use is debated, as high residuals don't always mean feeding intolerance. Jejunal administration is delivering enteral nutrition directly into the jejunum, small intestine, through a nasojejunal tube or jejunostomy, used when gastric feeding fails, like in gastroparesis or severe reflux, ensuring nutrients bypass the stomach, per Frontiers in Nutrition 2024. Want me to explain one in more detail or related risks?
Well, yes, and talk to me about nasogastric feeding, and different types of enteral access in general, and yeah, nasal, percutaneous. So this is route of access, and then the feeding, how it's delivered, gastric versus jejunal, then endoscopic versus interventional radiology in regard to how was the access put in.
Enteral access for nutrition support varies by route and placement method, with nasogastric and other types serving different needs. Nasogastric NG feeding uses a tube through the nose to the stomach, ideal for short-term support, less than 4 weeks, in patients with intact gastric function, like those with swallowing issues or low oral intake, per Clinical Nutrition 2021. It's simple, bedside placed, and delivers formula directly to the stomach, but it can cause discomfort or sinus issues. Nasojejunal NJ tubes, also nasal, go past the stomach to the jejunum, used for patients with gastric issues like gastroparesis or high aspiration risk, often placed endoscopically to ensure accuracy, per Frontiers in Nutrition 2024. Other enteral access includes percutaneous methods for longer-term needs, over 4 weeks. Percutaneous endoscopic gastrostomy, PEG, involves placing a tube through the skin into the stomach using an endoscope, common for stroke or cancer patients, with about 20% of enteral patients needing it, per Stat Pearls 2024. Percutaneous endoscopic jejunostomy, PEG, targets the jejunum, used when gastric feeding fails, like in severe pancreatitis. Interventional radiology can also place these tubes, radiologically inserted gastrostomy or jejunostomy, RIG, using imaging guidance, often for patients too unstable for endoscopy, with similar outcomes but slightly higher complication rates, like tube dislodgement, per Radiology 2023. Gastric feeding NG, or PEG, is preferred for its simplicity and natural digestion path, while jejunal NJ, or PEG, is for bypassing stomach issues, though it needs careful monitoring for tube migration. Endoscopic placement is more common, used in 70% of cases, due to direct visualization, while radiology steps in for complex cases, like altered anatomy, per Clinical Nutrition 2021. Want me to dive into one access type, placement risks, or feeding delivery specifics?